Good morning again, everyone. I'm Stacy Arneson. I'm Chief of the Disaster Information Management Research Center here at the National Library of Medicine, and I will be introducing our speakers today. Thank you so much for joining the Humanitarian Evidence Week webinar on improving the availability of reliable health information. We have two speakers today, Dr. Neil Pakenham-Walsh and Robin Taylor. And before I introduce them, I will take just a few moments to describe the National Library of Medicine and its Disaster Information Management Research Center, or DIMRC. I think most of you probably know the National Library of Medicine, or NLM. It is the world's largest biomedical library and part of the United States National Institutes of Health. NLM has provided health information for over 180 years. Most of you are probably familiar with PubMed or Medline, which is the index of the biomedical journal literature, and perhaps PubMed Central, the full-text archive with over 4 million full-text articles available for free. And others might be familiar with our resource for the general public known as Medline Plus. But you may not be familiar or aware of the wealth of other databases and resources from NLM. And specifically, I'm talking about those in disaster medicine and public health emergencies. For nearly 10 years, NLM has had a Disaster Information Management Research Center, also known as DIMRC, that has developed and provided resources for that disaster medicine and public health emergency community. We go to the next slide on, yes, thank you. As you see here, our vision ties in with the Humanitarian Evidence Week webinar today to connect the disaster medicine and public health emergency community to evidence-based quality disaster health information and innovative informatics tools to foster a culture of community resiliency and to enhance health security. Our activities are broad and range from the traditional access to literature, such as DisasterLit, which we'll hear more about today, and PubMed, which I already mentioned, along with subject or information guides, to also training librarians and actually anyone interested in health information related to disasters through our Disaster Information Specialist Certificate Program, which has a number of courses, including a brand new one that we'll talk about later on packing your digital go bag, as well as developing tools and apps, several for CBRN incidents, also known as chemical, biological, radiological, or nuclear incidents. Well, now let's focus on the evidence-based literature and resources. First, we're going to hear from Robin Taylor, who works in DIMRC. She's been here for about a year and a half. She is a librarian that recently earned her MLIS last December. Previously, she's worked at the Library of Congress and with various library and information organizations during her 7 years living in Africa. She will be followed by Dr. Neil Pakenham-Walsh, who is the coordinator of HIFA, the Healthcare Information for All campaign. He is also coordinator of the Global Healthcare Information Network. He is chair of D Groups Foundation, a partnership promoting a dialogue for international health and development. And he started his career as a hospital doctor in the UK and also has clinical experience as an isolated healthcare worker in rural Ecuador and Peru. For the past 20 years, he has been committed to the global challenge of improving the availability and use of relevant and reliable healthcare information for health workers and citizens in low and middle income countries. And he is based in Oxford, near Oxford. So I will turn it over to Robin now.
Thank you, Stacy. She gave a great overview of our activities in DIMRC, and as she mentioned today, for today's webinar, I'm going to focus on our DisasterLit database. So first, I'm going to give an overview of the DisasterLit, the scope of our documents, our intended audience, and the resources within. Starting with the audience. We have two broad audiences, two primary audiences for DisasterLit and for all our disaster health information. One is the disaster workforce, which includes professionals such as emergency responders and healthcare professionals that respond to disasters. The second audience is librarians, not just medical and health science librarians, but even public librarians who are interested in preparing their own libraries and also helping their communities prepare for disasters. Our audience, our stated audience, is not general public, though of course they are always welcome to use our resources. but the language and the types of documents we include are going to be more appropriate for a professional audience that is familiar with the disaster vocabulary and principles of response and recovery. So why librarians and libraries? Well, there's a few reasons on the slide that you can read. Librarians are information specialists. Information is key in a disaster. Librarians are also service-oriented and based in their communities, and they're familiar with many people in their communities. And the libraries themselves are, the physical infrastructure is an information hub with computers, internet access. Sometimes in the middle of a disaster, it may be the only place with electricity. And the fourth bullet there is a link. I will show you, we have a bibliography to show you what kinds of different ways that libraries have been responding to disasters. So you can see already in 2017, we have some articles that are about librarians responding to the protest and violence in Charlottesville, responding to the opioid disaster, and responding to the hurricanes from this remarkable hurricane season. And it's official as well. In the most recent version of the Stafford Act, FEMA has named libraries as an essential community service, which makes them eligible for federal assistance. Okay, next I'll talk about disaster health information and the scope of the information that we include. So the pyramid, which you may have seen if you've attended any of our webinars previously, shows at the top the peer-reviewed scholarly literature, which is journal articles and books. And these things, if you're familiar with them, they take a lot longer to publish. And a lot of disaster health information does not get included in these types of literature. But the much larger base of the pyramid is what we call gray literature, which includes the types of documents you see listed there: reports, summaries, surveillance data, training materials, conference proceedings. These materials are not peer-reviewed, but are no less authoritative, and they are available much more quickly, as well as being freely available. You don't have to be a subscriber to an expensive database in order to access them. Here's a definition of gray literature: that which is produced on all levels of government, academics, business, and industry in print and electronic formats, but not controlled by commercial publishers. And for the purposes of Disaster Lit, we deal only with the electronic formats. And our working definition from day to day is everything that's not in PubMed, because PubMed, another product of NLM, is going to have an index of all the indexed peer-reviewed articles that we talked about earlier. And so what we try to do at DIMRC is to supplement PubMed and not duplicate the work. And here are the kinds of topics that we cover. If you've been to our website before, or our database, these are going to look familiar. We cover, of course, natural disasters like the hurricanes this season and the wildfires, as well as the CBRN incidents that Stacy mentioned earlier: chemical, biological, radiological, nuclear, and explosive incidents. We also focus on some special topics like children in disasters, mass gatherings. I know we have pregnant women in disasters, ethics, and a very popular information guide of ours is coping with disasters. And lastly, we also deal with pandemic or epidemic diseases, outbreaks following disasters, as well as outbreaks that become their own disasters, such as the 2014 Ebola outbreak. Okay, for today, since we're interested in evidence, I'm going to focus a lot on our selection process in great detail. So our selection process for the Disaster Lit database is to, first of all, select credible sources, then prioritize them, follow them closely, and then make individual selections of resources. So selecting resources, much of this work, the great majority of it was done before I came to DIMRC, and you can see on our website there's a list of the organizations that we use for sources. I'm going to hop over there quickly now and see. Oops. Sorry, I want to show you our list. Here's sources scanned for Disaster Lit. As you can see, there's hundreds. These are sources that we have deemed to be credible, authoritative, and reliably producing high-quality information related to disasters. Now, following that many very closely would be difficult, so we've also prioritized them. Our priority one sources are mainly groups that you might have heard of already, groups from the United Nations, the World Health Organization, many U.S. health agencies. And those are the ones we follow most closely. In fact, daily, which I'll talk about in just a moment. But I should say, although the majority of sources were already in place when I joined DIMRC, we add sources definitely monthly, sometimes even weekly, depending on the kinds of resources that we're finding. So how do we follow our priority 1 sources on a daily basis? I have 3 screenshots here. One of these is, well, let's see, let's hop over to the web again. I'm going to show you Feedly, which is a tool we use to follow RSS feeds. And you can see in our list here, this is a list of our priority 1 sources that have recently published information in their RSS feeds. And over here, if you're not familiar with how these tools work, this is a list of the articles in the feeds. So I am in here daily, reviewing all these sources, scanning them. There's a great deal, I would say most of it, we do not add to Disaster Lit, but every day I'm finding things that we do end up adding that are in scope. In a similar way, we also monitor these same sources on Twitter, since that's a major way that a lot of organizations release their resources. So here's our list, our Twitter list, where we follow those. And lastly, we also subscribe to newsletters and other kinds of announcements by email from these same groups. So it's a little bit duplicative, but sometimes a group will tweet something that they fail to put in their RSS feed, or it gets omitted from their newsletter. So we make sure we catch everything that way. So for the resources themselves, SIS, which is our division here within the National Library of Medicine, has developed some guidelines for selecting non-NLM resources. They must be authoritative and credible. They must be current. There's no conflict of interest or advertisements. They must be freely available, audience appropriate, and language appropriate. So language appropriate for us means it must be available in English. It may be available in other languages as well, but it must be available in English. And I want to pause and emphasize current as well. We are, as I said, scanning daily for new resources. We do add some slightly older materials, but we also maintain a high awareness of current events. So when there are things like a very active hurricane season or wildfires in the western U.S., we are scanning more closely for resources that would help our users respond to those disasters, or help our users help their communities respond to those disasters. And it informs our selection somewhat. Oops. I think I hid my last slide. So just to review really quickly, we pick our sources based on their credibility and authority. So by the time we pick individual resources from those sources, we could already count on them being high-quality information. They have to be in English. They have to be freely available online. And they have to be current. Okay, now I'll talk about some of the features of our Disaster Lit database. As of yesterday, we had over 13,000 records available. Our records have a few different pieces to them, including a URL, a source, a brief annotation, and alternate links if there's other sort of related links for the record. The second bullet here I want to emphasize, we link out to our resources. We do not host them in our database. We're not storing all these documents. And there's a few reasons for that. I mean, the main one being that it improves the currency of our records. If we sort of scoop something up and save it in our database, we might not notice if it gets updated. But if we link out to it and it does get updated, oftentimes that link will break, and we have a URL checker to help us find those, or else the link itself will redirect to the newer record. So we want to make sure that our users are always finding the most current information, and that's one way that we do it. Disaster Lit, this version of it has just a simple search, no advanced search, but once you do have your search results, you can use some filters, such as source, publication year, format, to narrow down your results. We have a handy list of recent additions if you just want to see the most recent documents that have been added. And there's a search guide with a lot more detailed information and some search tips. Okay, I'm going to go over to Disaster Lit itself. And, okay. So here's Disaster Lit. And a little trick that you can do, I already did it, I'm not going to do it now because it's a bit slow, but if you come to Disaster Lit and enter nothing in the search box and click search, it will pull up all records. So you can see that today there's 13,527 records. And as I said, is a simple search, but it does support Boolean searching. So I'm going to type hurricane and flood, like so. And you can see that there it finds 84 records that have both hurricane and flood. So there's a few other features I want to touch on. They're sort of working in the background here. I mentioned the Boolean, and you saw me use those operators. It does stemming as well, which means it's going to find different variants in word forms. And it uses some synonyms in the background, which is sort of custom to disaster lit. We use mesh terms. So when I enter the word hurricane, it's going to find records not only with the word hurricane in them, but also with the word cyclone, typhoon, and other synonyms that you would find in the mesh vocabulary. And lastly, you can see these filters. I'm going to flip back here. You can see filters over here. I've found 84 documents about hurricanes and floods, but maybe I want to find only the training material. So under publication type, I could check that box. And now I've restricted my results to only that. And I have 9 results. Okay. There's my tip for finding all records. Oh, and I had a search also where I'm going to go back to my all records, and you can also look for I'm going to look for some of our partners in here. So once again, I'm going to hit search on the blank search box, and it's going to pull up all the records. And then for Humanitarian Evidence Week, sorry, it's a bit slow to do this. I should have done this earlier. Here we go. For Humanitarian Evidence Week, I'm going to look for, here's ALNAP. I'll check them off. It's going to restrict my search to just records from ALNAP. So you can also restrict to records from particular sources this way by using the filters. And again, for Humanitarian Evidence Week, let's try a search for evidence. You may have noticed that I didn't mention evidence yet. We don't restrict ourselves to only evidence-based resources, but nonetheless, we do have a number of them in disaster lit. So when I search for evidence, I get 341 returns, some very recent ones. These are about the opioid epidemic. A lot of our recent materials are about that, also Zika. Anyway, that could be a good way to find evidence-based resources if that's what you're looking for. And lastly, I know that our audience is particularly interested in humanitarian evidence. Sorry, if I can spell it right. I'm going to look just for the word humanitarian. And we have a lot more records on that, 711, including very recent things on the Rohingya crisis in Bangladesh, using social media, safe spaces for women and girls. We have many, many documents on humanitarian issues. Okay, if you're particularly interested in evidence and research, I'm going to point out one of our filters down at the bottom here. Research tools includes research tools. And this means, quite simply, correct me if I'm wrong, Stacy, but that the record is talking about a document that includes actual research tools such as survey questions and that. Is that correct? Yeah.
Right. So these are actually tools that have been used and published about in most cases. So used and published about, and they've been used in a disaster specifically. Okay. So at this point, I'll talk briefly about the Disaster Research Response Program, which is a trans-NIH partnership with DIMRC and NIEHS, which is also part of NIH. And we, DR2, as we call it, has, I don't know why it's doing that. Well, I'll go back to my slide and show you the slide. I don't know why it looks like that online. There's a database of tools and resources in DR2, which is literally a subset of disaster lit. So if you're in disaster lit searching and you check the box that says includes research tools, those are the kinds of resources that are going to be found in DR2. I did a search here earlier to limit to specific disasters. And the URL is there. You can try it yourself. I don't know why it's not working for me right now. Okay.
I'm going to wrap up so that we can get to our next speaker, but let me just mention a few things. If you want to follow us, if you're not familiar with us already, there's a number of ways to do that. We have an RSS feed available on the right side of our homepage. You can see new documents from Disaster Lit, and you click on more, you'll get to access lists of more recent documents that we've added. We have a listserv, which is a discussion group with about 1,400 people on it. It's not too high traffic, but it is a multi-partner discussion, so there will be other groups besides us contributing to it. If you just want to hear updates from us, you can subscribe to our Gov delivery list. These links are available on the left side of our homepage under that Stay Connected. There's a discussion list, and email updates are the two choices you have. These webinars, you'll get notified on either of those lists when these webinars are coming up, or you can check our homepage where we always announce them. We're on Twitter, very active on Twitter, and lastly, I won't go into it, but if you want to embed our content on your site, that's also possible via the HHS syndication storefront. And I guess these slides will be available later with all the links that you would need to access those. And I've been showing you our current site, but I wanted to give you a quick sneak peek of our new site coming soon. This is going to be what our new homepage looks like. It's going to have the same great information resources, but organized hopefully better so that you can find things more easily and more quickly. And it's going to include some new Disaster Lit features. It looks similar, but there's you may notice there's an advanced search, so you'll be able to do like a multi-field advanced search, which you can't do now in the current version. And some other new features will be added, so watch out for that. And I believe that's all I have for now. Should I take questions now? And then, are there any questions I can answer now, or should we save them to the end?
We can maybe take a couple questions now.
I'll take, since it's, yeah, we still have a couple minutes, I'll take a couple questions now.
Yep. So we have one user who is amazed at how much information that we have. He works with a humanitarian organization, and how can we put our records in? Because it's very important for people to see the reasons they're helping internationally displaced children.
Okay, well, I would urge you to email us if you, let's see, I have a slide at the end here. I was going to show this later, but you can see our email address there. If you have resources that you believe should be in Disaster Lit, you can use that email address on the screen. That's nlmsisdimrc@mail.nlm.nih.gov. Email us there and let us know who you are and where we can find your resources, and we will definitely check them out.
Okay. Another one was from Neil. Is the remit for Disaster Lit national or global? And I have answered that our resources, although domestic and U.S. focused because we are a federal government agency, are available to anyone across the world, and we do include a lot of international information and resources. Okay. Another question was, do we have examples of information needs assessments of humanitarian workforce?
Well, let's see. Let's search, shall we? Information needs assessment. I'm just going to type that in and see what I get. I feel like we entered some of these recently, but I wish it would stop asking me. When I search on those terms, I'm not being very precise here, but when I search on those terms, I'm getting a lot of responses. I wonder if I put information needs in quotes here. I would play around with the search in this way. This has narrowed it down a lot. Information needs assessment, in quotes, that exact phrase in assessment is bringing in 37 results. So I think these are going to be more about information needs assessments that have been performed already. These look like they're mostly reports and things that have been produced. Although here's the CHS Humanitarian Standard Manual for self-assessment. I hope that's helpful.
Okay. What are the most popular resources for humanitarian workers?
That's hard to say. We don't know a lot about who our audience is. Being the federal government, you may not realize this, but we're not allowed to track our audiences very closely, so we don't know in particular what humanitarian workers are accessing through our statistics. Anecdotally, I don't know if we have any particular resources. I just know that in general that two of the most popular pages on our website have to do with coping in disasters, sort of psychosocial and behavioral health issues, as well as our disaster apps page. I would encourage you to explore our website and look at those. within disaster lit. I'm afraid I can't say any more specifically.
We haven't done any analyses, and again, we try not to track who's searching for what. We don't look at that information, and at most what we would do is just see what across the board what people have searched, but then again, we don't know what they would then click on and what they would find most useful.
Yeah.
And then the other question is there a global equivalent of DIMRC or disaster lit?
Maybe someone else might be able to answer that question. We are not aware when we have tried to look to see who's doing it, and we are somewhat global. I mean, we do include information on disasters and health from around the world, and we do have a lot of information from international organizations as well. So I don't want to give the impression that we're solely U.S. focused. But I am not familiar if there are others who are doing something similar in developing sort of a current awareness database in this area. This was something that was started, and we had done our own needs assessment here to see that the concern was that a lot of the literature was not getting into the journal literature and therefore not into PubMed, and that sort of generated the need for a database like this.
And that kind of ties in with one of the earlier questions we had about how much of our information or resources is international versus domestic. Do you have a feel for the relative proportions?
Oh, that's a good question. I don't know, but if you really want to know that, send me an email, and I can figure that out for you pretty quickly, I think. But I don't know off the top of my head. Please send us an email.
I think it also probably depends what's going on. So certainly during something like Ebola and Zika, which were clearly international, we added lots and lots of, during those time frames, it would probably be predominantly international. Now that we've had some domestic, issues with hurricanes and wildfires, we'll be seeing more of the domestic things that are coming out. Sometimes it just depends on what's happening in the world. All right, we shall now move on to Dr. Pakenham-Walsh, and I will turn it over to you.
Fantastic. And I'll just start slideshow. So, great. Hope everyone can hear me okay. Thanks, Robin, and thanks everybody for joining us for this webinar. Great to see the work that doing and to actually see some searches in action. Fantastic. I'm going to be talking about the project that I run called Healthcare Information for All. We're a global health network with more than 17,000 members in 177 countries, and our website is HIFA.org, and I'm hoping that all of you who are not already members will join after this presentation. And this is a contribution to the Humanitarian Evidence Week, where we are working with National Library of Medicine and others, and with Evidence Aid to raise awareness of humanitarian evidence and its importance. Now, Stacey gave me a nice introduction at the beginning. Thanks very much. So I won't, but just to say that I have spent a long time, a checkered career, you might say, starting as a doctor in the National Health Service, and then medical officer for brief periods. I emphasize in Ecuador and Peru, medical publishing, where I got interested in information needs, and then actually working in the area of meeting information needs. Now, some of my friends say, well, it's a lot of time because all of that lot took about 15, 20 years. You could have saved a lot of time just by training as a librarian right from the start, and maybe indeed they are right. I think in a way, I'm a librarian at heart. The outline for my talk is I'm going to talk in the first 5 parts about HIFA generally, and then at the end I'll say a bit about one of our projects, which is on library services with a special emphasis on disasters and humanitarian response. So starting with why HIFA is needed, it's basically because people are dying for lack of knowledge, often very basic knowledge too. Literally thousands of children and adults are dying needlessly every day because they don't receive life-saving interventions. And the important thing is that these interventions are actually often locally available, but they are simply not provided due to indecision, delays, misdiagnosis, and incorrect treatment. An example that I like is childhood diarrhoea. Now, this simple disease causes more than 2,000 deaths in children every day. Now, that's more than AIDS, malaria, and measles combined. And many of these deaths, in fact, most of these, are actually due to lack of basic healthcare knowledge among parents and/or health workers. Now, we all know that a child with diarrhoea needs more to drink, needs rehydration solution, which is basically just water with the right amounts of sugar and salt added to prevent death. But research shows, and the references are on our website, that in India, for example, 4 in 10 parents actually give their child less to drink if they develop diarrhoea, which is actually tragically increasing their risk of death. And this is appalling. And there are problems also with regards to treatment by health workers. Again, in India, 1 in 3 workers will give a child with diarrhoea antibiotics instead of rehydration solution. But this issue is not confined to diarrhoea, nor indeed is it confined to child health. It's across the whole area of health, and so it concerns all of us, and especially us as librarians and information professionals. I did a review with a colleague on the information needs of healthcare workers in development back in 2009, and the studies we found reveal a gross lack of knowledge about the basics on how to diagnose and manage common diseases, going right across the health workforce, and often associated with suboptimal, ineffective, and dangerous healthcare practices. Now, this is not something that is the fault of the health workers most often. It is related to a lack of access to healthcare information, and indeed failure to meet other needs of health workers with regards to, for example, medicines and equipment. In 2004, I co-authored an article in The Lancet with Fiona Godley, who is now the editor-in-chief of the BMJ, Achieve Health Information for All by 2015. And in this article, we said that we portrayed the issue as being one of a failure of the global healthcare information system. This global healthcare information system focuses all of health research, the publishing of health research, systematic reviews and guidelines, producing reference and notes, and making information available. By definition, this system is not working because it is the rule rather than the exception that people do not have access to the information they need in low and middle income countries when they need it. So our goal is a world where every person will have access to the healthcare information they need to protect their own health and the health of others. And when we launched in Mombasa in Kenya in 2006, the World Health Organization gave us a letter of support which said that HIFA is an ambitious goal, but it can be achieved if all stakeholders work together. Indeed, what we are trying to do, we are trying to bring together all the stakeholders, researchers, librarians, publishers, policymakers, health professionals, and others in promoting communication around information needs and how to meet those needs. And we do that through a number of online HIFA forums. We extract the key points from those discussions and place them into a HIFA Voices database and use that information for advocacy to promote increased awareness of health information as a global issue, and also to promote increased investment, political and financial, in health information activities. We now have 5 forums in 3 languages: English, French, and Portuguese. The main forum on the left is HIFA. Then we have a child health forum, Portuguese, French, and a single country-focused forum, HIFA Zambia. Altogether, we have 17,500 members, and our main funder is the BMA. The strategic partner is the World Health Organization. This is a graph that shows the growth of total forum membership since we launched, showing that we are approaching 18,000. And this is the interface for our HIFA Voices database, where you can search on different users of healthcare information, geography, and so on. An example of our advocacy is that we worked with the New York Law to examine the role of governments in international human rights law, concluded that governments have a legal obligation under international human rights law to ensure that citizens and health workers have access to the information they need to protect their own health and the health of others. These are the websites, and I do hope that you will join us by going to this website after the webinar and sign up. Of course, it's free. This is the website here, and just click on join or go direct to the join page, and a very simple form to fill in, and then you will become a member, and your journey of discovery will be about to begin. If you're already a member, then there are lots of ways you can get more involved. For example, you can become a country representative, and we have some 160 country representatives around the world who help to promote HIFA and encourage people in their countries to join. You can also invite your CEO or senior manager to put in an application to become a HIFA supporting organisation, and we have more than 300 supporting organisations now around the world, which are health and development organisations that share our concern about access to health information. About 40 of those organisations also provide a financial contribution. Often it's only a small amount. No obligation, if you choose to become a supporting organisation, to make a financial contribution. The way that you can get more involved with HIFA is by joining up with one of the HIFA projects. And we've now got 12 of these projects active at the moment. And each project brings together volunteer HIFA members who have an interest in the area concerned and who lead the wider HIFA community in structured discussions around the various topic areas. So I'd now like to focus particularly on our Library and Information Services project, which started at the beginning of this year, and which is particularly relevant to Humanitarian Evidence Week and webinar. So our purpose is to support communication, understanding and advocacy on the role of library and information in global health, and our current focus is on disasters, disease outbreaks and humanitarian action. The members of our group include representatives from the National Library of Medicine, that's Dan Garandassi, Evidence Aid, HILA, ALNA and the World Health Organization, and we are supported by Public Health England. Our activities include an evidence briefing, a grey literature search, thematic discussions on the forums, and the support for current Humanitarian Evidence Week. Now, here are some personal reflections on what discussion so far. We are currently actually in the middle of our second thematic discussion. Each one lasts 4 to 6 weeks. We had one a couple of months ago, and we are in the middle of a second discussion now, which is on the theme of informed humanitarian action. And what I'm picking up from these discussions so far is that it seems to me that humanitarians rely largely on empirical knowledge, i.e. things like lessons learned, such as is found Sphere Handbook, which many of you may be familiar with, together with local needs assessment and local information. There's low availability and awareness of information sources, especially in low and middle income countries. Effectively, I think I get the feeling that the disaster health information sector isn't working as well as it should be, and that there is a limited but important role for evidence-informed humanitarian action. And when we use this term, we refer to action that is informed by cumulative and systematic review. This is analogous to the term evidence-based medicine. There has indeed been an interesting blog on the Evidence Aid website published today, which challenges whether evidence-informed humanitarian action is actually useful or not. And this is the kind of thing that we're discussing at the moment. And of course, library and information professionals have a vital role. So my thanks to all of the people on the HIFA Library and Information Services Project Working Group who are listed here. And lastly, I would just like to acknowledge and thank all of the 40 organisations that are supporting us in 2017. As I mentioned, many of these organisations are only able to provide a small amount, like $60 or $70 each. But the total all adds up, and overall HIFA is running on an annual budget of $45,000 per year, approximately. Was to increase that next year so that we can engage more staff. So thank you very much for listening. As I say again, please do join HIFA or email me on neil@hifa.org. Thank you.
Thank you, Neil. That was great. That was a great introduction to HIFA for those who are not yet familiar with it. Oh, pardon me. Let me share my screen. Thank you so much. I think we have a few questions, actually.
Yes. The first question is, what qualifies as information? How do you assess the quality of information that HIFA seeks to share and spread?
HIFA does not itself assess and formally assess and or even distribute information. It's easier to think of us as a kind of online conference where providers and users of information come together to discuss issues around how to improve the availability of information for different end user groups contexts. So, for example, we have a few hundred members who are staff of the World Health Organization. In like 2,500 organizations represented across the network. So primarily we are like a virtual conference discussing the issues rather than primarily a means of information dissemination. I think that there is no such thing as it would not be possible for any organization to set itself up as a be-all and end-all for information dissemination. The nature of information needs is such that there is required a whole range of different types of information, different formats in different languages and at different technical levels for each level. Having said all this, there are on HIFA many messages where people are making other people aware of new guidelines as they are released. So there is an element of awareness of information, and thereby one of the benefits, though not the primary benefit of being a member of HIFA, is that you will keep alert to some of the new literature, but it isn't actually set up to be a news service in that.
Okay, thank you. The other question we have is, based on the information given, how would this affect the internally displaced children, especially when organizations help by giving relief materials instead of the necessary help that they need?
I'm not quite sure where this comes in. We don't a direct. There's something to do with it. The question was around internally displaced children. Now, internally displaced children is not the primary focus of HIFA. However, we do, as I mentioned, have a child health forum called HIFA, which is concerned both with the information needs of health workers and families and children to protect their own and the health of others, and is also concerned with health rights of children. So there is some discussion on the HIFA forum around the information needs of internally displaced children, and in fact there has been a couple of conferences organised by HIFA's administrating organisations. We work in collaboration with the International Child Health Group at the Royal College of Paediatrics and Child Health and the International for Social Paediatrics and Child Health. And both of those organisations have held conferences which have linked into HIFA with some discussions around issues to do with refugees. This in the last few months, because I'm sure you're all aware, refugee issue in Europe, particularly for people migrating from Africa and the Middle East into Europe, is a massive problem at the moment.
Great, thank you. So I think that's it for questions right now.
Okay, thank you, Neil. Thanks for taking the time to answer those questions. And thank you also. I don't know if everybody realizes that this event was specially coordinated for Humanitarian Evidence Week this week, so welcome to those of you who are new and came through Humanitarian Evidence Week to hear what we had to say. There's been a lot of interesting discussions and blogs online this week around humanitarian evidence. This webinar has been recorded and will be available online in a week or two, so check back with us. In the meantime, you can reach us. The website URL and our email are shown there on the screen. And if you want more information from us or more information like this about disasters, I might point you towards our training courses. I think Jen is going to put the URL for our main training page in the chat box right now. And the link on the slide is for a brand new course. Well, it's a brand newly reformatted course, Packing Your Digital Go Bag. It's about disaster health information on your mobile device, specific apps that disaster responders might want to consider loading on their mobile devices to use. And then Jen will put the link to the training page, which has our other courses listed as well. I think that's it. Okay.
Thank you, everyone, for participating.
Great. Thank you.
Thank you.